Hi, everyone, and thank you for joining us today for Advanced Pediatrics webinar on dealing with depression, spot the signs, and find help. We're very excited to be partnering with Children's Hospital Colorado and would like to thank Dr. Jenna Glover, the Director of Psychology Training at Children's, for presenting on this very important topic. A little bit about Dr. Glover. Jenna Glover is a licensed psychologist and an assistant professor in the departments of psychiatry and pediatrics at the University of Colorado School of Medicine. Dr. Glover serves as director of psychology training at Children's Hospital Colorado. She received her doctorate in combined clinical counseling and school psychology from Utah State University. Dr. Glover's clinical work focuses on utilizing motivational interviewing and acceptance-based therapies with children and adolescents across a range of disorders. Dr. Glover also provides community outreach, giving talks and lectures on promoting wellness and self-care, and has given a TED Talk on these topics. She's been honored with awards for teaching excellence, service to students, and wellness. We're also joined by our very own advanced pediatrics providers, Dr. Beth Hempel and Dr. Meredith Merkleys. Thank you for coming and joining us today. Dr. Beth Hempel joined Advanced Pediatrics in 2018, and she graduated from the University of New Mexico School of Medicine in 2010, following undergraduate degrees in both biology and Spanish. Dr. Hempel completed her internship and residency at St. Christopher's Hospital for Children in Philadelphia, Pennsylvania, and her pediatric interests include helping children develop healthy habits at a young age and helping families through acute illness. Her personal interests include cooking, hiking, playing softball and golf, and spending time with her husband and her 2 daughters. Dr. Meredith Merkleys joined Advanced Pediatrics in August of 2019 after attending medical school at Ohio University. She completed her internship and residency at Nationwide Children's Hospital in Ohio, and her pediatric interests include adolescent healthcare and vulnerable youth populations, including youth who are unstably housed or homeless. Dr. Merkleys moved to Denver to be closer to her niece and nephews. Along with Dr. Glover, our advanced pediatric doctors will be panelists during the Q&A portion of tonight's webinar. Please remember to submit your questions throughout the presentation as they come to you using the Q&A feature, and we'll try to get to as many as we can following our presentation. Now let's turn over the webinar to Dr. Glover. Thank you so much again, and welcome and welcome and welcome.
Hey, thanks, Jamie. Happy to be here and welcome everybody. Appreciate you taking time on a Wednesday night to learn more about this really, really important topic. So appreciate the introductions. As we get started, one of the things I wanted to provide is just a little bit of information about the mental health services that are offered at children's hospitals. So as was stated in the introduction, I spend part of my time training psychologists, but the other part of my time I work with families, and I primarily work with depressed teens and teens who are suicidal. And so I'm one of many providers in the Pediatric Mental Health Institute. Our goal is to provide the highest quality of care for kids who are experiencing a mental health crisis or acute mental health problems. We have the range of specialists who work on our teams, from psychologists to licensed clinical social workers, psychiatrists, art therapists, and our focus really is on providing evidence-based treatment that not only helps the youth but also supports the entire family. Just so you have an awareness, Children's Hospital offers a full spectrum of care, so everything from inpatient care for children who are having an acute crisis who need stabilization and for their safety, to partial hospitalization programs. So this is for children who their safety is not at risk, but they're significantly struggling in completing schoolwork or attending to just daily activities of living. And this provides comprehensive support in a 4 to 6 week program, and then outpatient services, which include medication management, as well as individual and group therapy. So we offer a range of services from anxiety, aggression, depression, concerns with eating, withdrawals from relationships, nightmares, suicidal thoughts, kind of like the spectrum of anything that a child might be experiencing or an adolescent related to their mental health. We have a range of experts to address all of these different things. And then finally, we have a variety of locations that offer our mental health services. So we offer these services here on our main campus in Aurora. We also have these services at our networks of care in Highlands Ranch, as well as our North Campus and out in Broomfield. So it gives you just a very quick overview of the services at Children's Hospital and what we are spending our time here doing. We also down there, and I'll show this number again, this is a number that you can contact if you are seeking mental health services for your child, or you can go to our website, childrenscolorado.org, mental health. So with that, want to jump into our topic for tonight, which is essentially how to better understand and support your kid or kiddos. So first of all, understanding what are the signs of depression in children and youth. How do you talk to your kids when you're concerned about their mental health? So how do you start that conversation? How do you show up to make sure that conversation is effective? And then what are kind of the next steps that need to happen if you are worried about your child's mental health? So we'll go through each of these, and then the last 30 minutes of the presentation will be just your opportunity to ask questions. So feel free, as you have questions come up along the way during the presentation, to put those in the chat. So a few things that I just want to start out with is that mental illness is something that many children experience. So we know that 1 in 5 children have a mental illness. We call this the 20-20 problem. So 20% of youth end up having a mental illness, and of those 20%, only 20% of them actually get treatment for it. So the majority of youth will, who end up having a mental illness, will have that onset by age 14. So we know this is something that affects a lot of different families, and so it either affects your family or somebody in your extended family or somebody in your neighborhood. So mental illness is a part of life that many children deal with. Depression is one of the most common disorders that we see in youth and especially in adolescents. So we have 3.1 million youth ages 12 to 17 who have experienced a major depressive episode. One of the things that's probably most startling about this is that depression in kids and adolescents is missed or misdiagnosed in about 75% of them. And so it's really important to understand the signs. In terms of like how all this plays out, that means that kids who are under the age of 13, anywhere from 8 to 12% of them will experience depression. And then past the age, once you pass that age, by the time a teenager is 18, anywhere from 15 to 20% of them have experienced depression. So it's a large amount of kids that this impacts, but a lot of times we're missing it. And so it's important to think about what do we need to look at and what's the difference between just typical development and what might be a mental health concern of depression. There are a lot of associated risks. It's a bit of a chicken and egg. Did depression result in these things? Did these things result in depression? It's probably bidirectional. So we know that when a child experiences depression, there's associated risk for education problems, for impaired relationships, a higher risk for them using substances. And then we know that it makes physical symptoms worse. And so we see a lot of vague physical complaints, as well as more complex physical issues that are associated with depression. Now, if that wasn't already hard enough, the impact of the pandemic is really important. I try to have like a little bit of humor in all of my presentations. So this one speaks to me. If coronavirus was a person, basically everything is canceled. So one of the things about the pandemic is it's had a tremendous impact on kids' mental health. So a couple of things that we know, this was a Harris poll done of over 1,000 adolescents. And what we found from this is basically that rates of anxiety and depression among teens have doubled. So 55% of teens say they've experienced anxiety, 45% excessive stress, and 43% depression. So again, when you think about 20% of kids have experienced major depression prior to the pandemic, now we have double that number. This is something that definitely needs to be on our radar. One of the things that is happening is that there's this increased level of stress around life, around school because it's being done differently, and about the future. And all of that is contributing to how kids are feeling. I think one of the things that is most interesting to me about this report is that teens reported feeling more pressure to hide their feelings rather than to do drugs. And so we're always so worried about kids doing substances, but a lot of kids feel like they need to hide their feelings. I've got these numbers over here. 67% feel pressure to keep feelings to themselves. 67% said they need to pretend to feel better to not worry anyone. And 65% said they deal with their feelings on their own. So we know that this is a very stressful time for all of our kids, and they're likely to feel like they're not able to talk about it and that they need to just act like everything is okay. So something to kind of keep in mind. Well, why does all of this matter, and why is it important for us to think about how this chronic stress impacts kids? Well, mental health is really impacted by two different things. The first, so this is called the Diathesis stress model. All that means is the diathesis is what you're born with. So this is your genetic kind of background, your family history, any complications that happen during pregnancy or delivery. All of that's kind of like what you come to the world with. And some of us are more prone to have attention problems or anxiety or depressed mood. So some of us have really big genetic loading, so the blue part of our cup is really high, and some of us don't have a lot of that, so the blue part is really low. Well, the red part is stress. And the more stress that we have, the more likely it is our cup overflows and we start to have mental health problems. Now, we've been in chronic stress for over a year, and kids have been going through a lot of different things. So even if the blue part of your cup was pretty low, the stress part is pretty high, and that's why we are seeing double the rates of kids experiencing these things. So again, when we're under chronic stress, this is going to come out, and so it's likely that kids are going to be dealing with experiencing depression, and it's good to keep our eye on. Now, if you know that your kid has a strong family history of depression and anxiety, that's another thing to kind of keep your eye on of how the stress is impacting them. All right, so what exactly do you want to look for? When we think about warning signs of depression, they come in three categories. So there are thoughts, there are feelings, and there are behaviors. Now, it is very hard sometimes to know exactly what a teen's thoughts are. Sometimes it's not, sometimes they like to share those frequently with you. But the behaviors really are a great one to kind of key in. That's one of the more objective things that you can see. But in general, what we're looking at is in each of these categories, what are some of the things that you need to be aware of? And then if you're starting to see many of these things, that's when you start to say, okay, I think there's something really significant going on, and that my kid might be depressed. Okay, so what are some of the warning signs in terms of feelings? So with feelings, I'm going to throw these up here so you can take a look at them. One of the things that you want to think about is if your child is experiencing prolonged sadness for a significant period of time. And when I say significant period of time, what we basically look for is, like, for a 1 week period, does your kid basically seem down pretty much all day long, fairly persistently, and it doesn't go away? Or do you have a kid who 3-4 days, they're pretty down, and then the weekend comes and they seem to like change and things are okay, and then they kind of go back into it? When we start seeing that prolonged sadness that's lasting pretty much all the time for long periods of time, 1 to 2 weeks, that's when we want to start saying, okay, maybe something is a problem here. Also, expressing like hopelessness or empty, they kind of seem flat. One of the things that's most commonly missed in why kids and teens are misdiagnosed is they are more likely to show symptoms of depression through irritability and frustration rather than through sadness. So with adults, you're going to see more of that sad mood. With kids, they're going to have a very short fuse. This is especially apparent like if something very small triggers them, or their reaction is too big for the situation, or it lasts longer than the situation warrants. So this could be something like, somebody ask, how did your day go? And all of a sudden the teen is just like irritable, like, why are you always, like in my business, and can't you just leave me alone? And that really short fuse. Now, again, if it happens every once in a while, that's fairly normal teen behavior. But if this happens consistently and it seems really big and it lasts a long time, that's a sign of depression. And then finally, just ongoing fatigue and feelings of worthlessness. So some of the behaviors that you want to look for. One of the things that probably is one of the better hallmarks for identifying depression in your kids that you can observe is dramatic changes in their eating or their sleeping patterns. For some kids, they're going to sleep way more, and they're always in bed. For some kids, it will be significantly less, and they're having major sleep disruptions. Some kids will eat a lot more, some kids will stop eating. So it can look either way, but it's something that becomes very different, and you're starting to see, again, for weeks on end, these new behaviors. Withdraw from social relationships is a big one. So it's one thing that if a teen is like, I'm frustrated with my family, and they're withdrawing from you, which is very normal teen behavior. But if all of a sudden you notice they're not spending any time with family, they don't seem to want to spend time with friends, they're not reaching out to their friends the same way, that is a sign that this is probably a more chronic problem. Another hallmark symptom of depression is this is called anhedonia, big fancy term for essentially like your teen or your child has lost interest in something that they used to love. So maybe they love to play the guitar and now they don't want to pick it up, they don't care about it. Maybe they used to love playing a sport and now they show very little interest in it. So those are good keys that depression may be there. The other thing is, one of the things that happens in the teen brain when depression happens is that they no longer get any dopamine from planning an activity. So, you know, when we plan a vacation or we're getting excited about like going out and doing an event, we actually get dopamine in our system. And for children and teens, when they're feeling depressed, that part of the brain goes offline. So nothing sounds fun to do. Now, the good news is if you can actually get them out and doing something, that part of their brain that still enjoys an activity can come back online. But the problem is most teens and kids are not going to want to because they don't feel excited about it, even though they can still enjoy an activity. So what you'll see is a real resistance. I don't want to do anything because nothing sounds desirable to me because the brain has stopped rewarding me for making those plans. So you might see that resistance. Finally, self-harm may or may not be part of this, but it's commonly associated with depression. So if self-harm all of a sudden starts up, that might be a symptom of depression, and or if they're starting to talk about making plans related to suicide. For children, one of the things you might see as well is a regression in behaviors. And so you might have a child who was pretty independent and now all of a sudden like they refuse to feed themselves, or they refuse to like bathe themselves. So if you start seeing that regression to earlier behaviors, that's also a sign in children of depression. Okay, so finally, thoughts that are commonly associated with depression. So one of the things that we see is that all of a sudden there's this fixation on the past. So when I work with families, I always talk about that the depressed brain lives in this is what happened and why it's a terrible thing, where the anxious brain lives in the future. So if you have a child who is ruminating constantly on past failures, how this last year went, how terrible things have been, an increase in like self-blame, self-criticism, I'm terrible, I can't do anything right. And then you see this extreme sensitivity to rejection or failure. So I don't want to try anything anymore because I'm just going to screw it up, I'm just going to fail. Those are very common. We call it a negative attribution bias. So it's almost as if your teen puts on these dark colored glasses and everything in the world has that dark tinge to it, and they don't have any hope about themselves or the future. That chronic pattern of thinking is indicative of getting into a depressed episode. And then finally, difficulty concentrating. A lot of times people confuse ADHD with depression because kids like, I can't focus, I can't concentrate, I have a hard time remembering things. And that is all consistent with what we would expect a child who's going through a depressive episode to experience. Another thing that goes with for some kids with depression, and this is especially true for children and older children, they might develop what's called a hostile attribution error. And so this is when they interpret other people's behaviors as being more aggressive than they are. So if they're at school and a kid bumps into them, that person was trying to intentionally come at them. And that's where you will see a lot of the anger and the irritability manifesting as depression rather than the typical what you would think just sad, I'm a terrible person. It's more like people are out to get me, I can't trust anybody, and I feel angry and irritable most of the time. Oh, and then of course, suicidal thoughts. So suicidal thoughts are incredibly scary when your child has them. One of the things I encourage parents is suicidal thoughts are a symptom of depression. And the more serious or the more amount of times a child spends with suicidal thoughts, that's indicative of more significant symptoms of depression. Suicidal thoughts are often, I have a problem and I don't have a solution, or I don't think there are options, again, which is very consistent with a depressed mindset. So when suicidal thoughts come up, that is, again, one of the key hallmark symptoms of, okay, my child is likely experiencing a depressive episode. So all of these kind of come together, and they kind of feed into each other. So we've got, I feel low, I feel depressed, then I have thoughts that I'm gonna let everybody down, they're angry with me, I'm not a good friend, and then this feeds into kind of my behavior, I'm gonna withdraw from everybody, and the circle feeds itself. So very rarely will you have just one symptom in isolation when it's depression. So you might have some withdrawal, but if you're not seeing kind of the negative thinking, or if their mood seems to be okay, maybe it's something else that's going on. So again, you're looking for several of these symptoms in each of these areas, and that gives us a good sense that, yeah, your kid's not doing okay and they're in a depressive episode. Okay, so what do we do about this? How do we talk to our kids about mental health? One of the things I commonly share with parents, I like this quote: we take our kids for physical vaccination, dental exam, eye checkups. When do we think to take our son or daughter for a mental health checkup? So, in my home, we talk about mental health as an important part of our overall health. And so it's something that we talk about, it's something we check in on, and it's something we want to make sure that our kids are getting support with. So the first thing that's probably the most important, I'll send out this link. This is a great video. It's like a 1-minute video. It's called It's Not About the Nail. I was going to try to play it for you, but the sound is kind of weird. Essentially, you have two people talking to each other, and one has a nail in their head and is talking about the pain and how it's causing all of these different problems. They've got this headache. They don't know what's going on. And the other person is like, you should just take that nail out of your head. And the person with the nail in the head is like, don't fix it. I just want you to understand what's going on. I love this video because oftentimes as parents, our natural reaction is if our kid is struggling, we want to immediately fix it and take care of it. So instead, what you want to do is when you're having a conversation with your kid about what they're struggling with, know that the writing reflex will come up, and that is, I'm going to fix it, I'm going to solve it, I'm going to give suggestions, and just quiet that down. And instead, just listen and validate how they're feeling. So I hear you saying this, how can I support you? This is what I'm learning about you. So when you go in to have any conversation with your kid, make sure that you're in a space where you can really listen. Sometimes they might share nothing with you. Sometimes they might share something scary with you. And make sure that you're open to just hearing it. And instead of trying to fix it or make it about like, I have to take care of this, or what do I need to do? Just where is my kid at? So that's the mindset you want to be in. So kind of like that is the baseline. So how do you actually start the conversation? Here are some questions to ask your kids. So if you're starting to see some of these signs, their sleep has changed, their diet has changed, they're not spending time with anybody. They seem to just have this negative outlook on life. They seem to be really, really irritable. You can approach them with any of these type of questions. So just, a general question, what did you do today? What made you feel happy or stressed? Calling out, like, I've noticed that you might be overwhelmed, and I wonder what's making you feel overwhelmed. Or I've noticed that you are really angry most days, and tell me what you're thinking or feeling. What do you need to get off your chest? What kind of headspace are you in these days? You seem really distracted. What's going on with you? What does it feel like to you to be hopeless or depressed? A couple of things. So first of all, be prepared that your kid might just not answer any of these questions. Some of you are like, yeah, no, if I asked, I'm not getting anything. Kids are really good at shutting down adults and making us feel uncomfortable, so we don't ask them again. But don't push it. So you can start a conversation. So first of all, ask the question. And like, don't go in heavy with one of these questions. Like, start with something a little bit lighter. And then be willing to ask these questions. Wait 10 seconds before responding. Teens and kids need time to think, especially about heavy questions. So silence is where they're doing that heavy lifting and processing. So count to 10 in your head, wait for them to respond. If they don't want to talk about it, say that's okay. When would be a good time for me to check back in with you? So again, you're not going to push it, and you're also not going to let it entirely go. It's totally fine for you to be vulnerable and share about yourself. Just don't make it about you. So keep any type of share short. So you might say, you know, like when I was in high school, I really struggled. And I had a time where I was feeling very hopeless and depressed. And sometimes I wonder if you've ever felt like that. And then you keep it at that, and you talk, and you have your kid talk about it rather than going into too many stories or lessons learned. Okay, so with all of that in mind, you have the talk with your kid. Maybe they give you some information. It's like, yes, for sure, my child is really struggling. Or they don't give you a lot of information, and you see all these warning signs, and you're like, this is persistent, and it's getting in the way of their life. What do I need to do? So kind of the steps that I recommend. So depression is on a spectrum. So some people have mild depression, some people have moderate, some people have severe. And usually like the best first step is to talk to your primary care provider, talk to your pediatrician, and just determine what kind of needs to happen next. So if it's a mild case of depression, the treatment plan is going to be different than if it's a severe case of depression. Sometimes it's going to include medication and a recommendation for therapy. Sometimes it's going to include coaching to get, you know, more positive activities in the kid's life and more behaviors activated. So it can look a lot of different ways, but your primary care provider is a great starting point to figure out what steps do I need to take next. If it's determined that you need to do therapy, cognitive behavioral therapy is the best treatment for depression. It's as effective as medication for moderate and mild depression. It's a really, really good starting point. So that's the therapy you want to go with. If your kid also has suicidal thinking and self-harm or impulsive behaviors, there's something called dialectic behavior therapy that is also very helpful. So the good news is we have a lot of very effective treatments for depression. And if it's identified and treated, it can get better. So that's a very positive thing. And then finally, if you do have a teen who is struggling with suicidal thoughts, make sure to have crisis numbers available. So at my house, we have all the crisis numbers on the fridge because sometimes we get in crisis and we think of impulsive things to do, and we want to make sure that like anybody who comes into our house knows that that happens for people and they have those options. All the teens I work with, we sit down and we program in the phone all the crisis numbers. So again, if this is something your teen deals with, having those numbers on you or having them in their phone is helpful. So this is like my favorites list, and it's all the crisis lines that are in Colorado. So here are the main crisis lines. One of the things that's great about our crisis services in Colorado is teens can text the number TALK and have a text conversation, which is usually more comfortable for most of them. So again, for many people, this might not be part of the picture. And for a lot of kids, it is part of the picture. So just having these resources available if they're ever needed, and normalizing that it's okay if these feelings come up. This is just how we're going to support you if they do. All right, so with that, final reminder, and again, if I've gone through this presentation and you're like, oh my gosh, I think my kid is experiencing depression. Again, first step, talking to your pediatrician is a great step. If you're like, I know my kid needs services, I would like to get my child some support, individual therapy or group therapy. Again, we offer these services at these locations, so you can contact Children's Hospital as another resource. There's several different resources in Colorado for providing these services. So Children's is not the only place, but it is one of the places that you can turn to as well. So with that, we'll spend the remainder of the presentation just taking your questions.
All right, great. Thank you so much, Dr. Glover, for your presentation and all those helpful resources. And then we've got our Dr. Merkleys and Dr. Hempel on. in a moment. So we'll go ahead. We do have a question in from a parent. It says, what does a parent do if their older teen, who's 17, acknowledges that they're depressed, but they refuse to go to the doctor, even if it's just to discuss next steps? Dr. Glover, you want to go ahead and start? And you guys can just jump in whenever you think. I'll start with Dr. Glover, and then we can just do like a round robin.
Yep. Yeah, this is really, really difficult. And so I do think parents run into this where teens will basically say, look, I'm not going to do this. I'm not going to get the help. So the first thing I do is encourage parents to continue to have the conversation, to express if you broke your arm, if you had any type of like ongoing physical illness, like we would insist that you go to the doctor. And we are very concerned about your well-being. And so this is why we keep bringing it up to you. And then I would just have a conversation of like, what's getting in the way? Why are you worried about going to the doctor? And have that open conversation. And, you know, is it about that I don't think I have a problem? Or is it about I don't want to get help for this, or there's some concern about going to therapy and sharing my feelings, but getting a better sense of, first of all, expressing your concern and why you're pushing this, and then a better sense of like why they are resisting it. And then from there, being able to just, again, revisit the conversation periodically. If they don't think they have a problem, then you can kind of share like, would you be willing to like hear why we are concerned about you? If they say no, drop it and then come back to it. Sometimes you have to be very patient with it, but I would continue to have the conversation and just explore what the fear is around that, and also be consistent in expressing your concern.
Thank you. That's great. Dr. Merkleys, what are your thoughts?
Yeah, and I would add on to what Dr. Glover had mentioned earlier, and just having that easy access to any crisis numbers, any maybe helpful apps that they can go to for mental health resources. And that can be something that they can have that initiative. The conversation has been started. So like Dr. Glover said, sometimes they can just be embarrassed or more hesitant to burden others in a way by talking about it, but having those easy accessible things at home where they can go to that at their own time as well can start to engage them in that movement forward. And then one other thing is seeing maybe if another avenue in kind of helping to start the conversation. So if that's through going out for a walk during the conversation, if they really like to draw, incorporating some drawing into that conversation too, that kind of takes a little bit of that pressure off some of those heavier topics and can allow some of that ease for those conversations as well.
Yeah, I think that's really important, especially given the statistics that Dr. Glover mentioned with the kids not, just thinking that they need to hide their feelings. So that's good advice. What about you, Dr. Hempel? Any thoughts on that?
I think both Dr. Glover and Dr. Merkleys covered most of it. Just, kind of coming back to the conversation periodically, being patient with them, making sure that they know that they're in a safe environment. A lot of kids, they still have that big stigma around mental health, is viewing it as somehow that they are broken or there's something wrong with them, and more viewing it as a physical ailment. There's actually a nice video from a gold medal athlete that the New York Times had, who talked about her struggles with depression and talking about how, if she had approached it as like a pulled muscle or something like that, she would absolutely be in doing the training, seeing her physical therapist, taking the medicines and doing the rest, and kind of trying to encourage kids to view it more as something, as mental health is just a part of their overall health, rather than some sort of like very taboo thing that like, oh, if you're depressed or anxious, there's something wrong with you. There's nothing wrong with you. Lots of people have depression and anxiety, and just more making it a very comfortable place for them to talk about it.
I think that's really, really true about the stigma, and removing that, and kind of like Dr. Glover said, just making it more like, well, you get your well-care check, you get your vaccinations, let's do a mental health check too. So I think that's really.
And if I, yeah, And if I could add just a little to that too, a lot for the teenage years is about those shared experiences and that kind of a realization that you're a part of the team. And so those, like Dr. Hempel was saying, just hearing some of those stories and sharing maybe some of those stories with your teens of other people who've had depression or anxiety or any of these symptoms as well, and kind of sharing those are kind of helpful conversation starters as well.
Yeah, that's great. That's just kind of.
Oh, and I was going to say one of the other things to think about too is making sure that if your kid is like not willing to go to the doctor to talk specifically about these, hopefully they still are doing their well checks, because the majority of primary care providers these days do a depression screening. And so that's another place that it could be caught and the conversation just be brought up, and they may or may not be open to it. But that's why it's so important to have like those regular visits, because more and more we understand how our physical and mental health is connected, and more that's just a regular part of wellness exams.
Absolutely. Definitely make sure that, your kids are getting in for their well care checks, because that's the place where they would be able to talk about it, at least initially, the first step. I have another question here. Sorry. As a parent identifying with depression and having a child teen that has identifying as depressed, what's the best way to not have the emotional push-pull? So for instance, what if your 11-year-old daughter refuses to talk to anyone? When she shares with me, she wants it to stay between us and would feel betrayed if I share it with anyone. What should I do? She doesn't trust most people and has a lot of loss and betrayal in her life. She has sensory and learning disabilities, and she gets bullied. She also has 3 years of therapy and mostly refused to really open up to the therapist. You guys have any thoughts on that, as far as getting your child to open up whenever they have trust issues? Dr. Glover, you want to start again?
Sure, be glad to. So thank you so much. What a difficult circumstance to be in. And I think, so first of all, the positives are that your child is talking to you. I mean, that's huge in and of itself. So there's some level of trust there in being able to do that. The second thing is there are still many ways that you can effectively improve depressed symptoms, even if it's not directly through therapy. So, when you can get your kid into therapy, do so. And the more you can do to try to establish a positive relationship with another adult. So if that is through music lessons, if that's through trying different types of sports activities, through art classes. Again, I know there are many obstacles because of the pandemic, but establishing those positive relationships where they can start developing a trusting relationship in a safe way is setting up in the future that maybe we can't solve this problem in 2 weeks. And maybe if we have a trusted adult experience in one other person, that we can start having a better relationship. In a year or two, your child might be ready to be at a place where they can engage in therapy. Sometimes it's very hard to think of like the long game in these things. What's the immediate way to change those patterns? But it's very hard to do that immediately. So I would say think about how you can get them engaged in these positive activities that would establish another positive relationship with an adult, even if that's not like you have to share your deepest, darkest secrets, just have that positive relationship to practice that. The second is, I think you can also share with your child like how much you appreciate that they are telling you these things and you care very much about them. And so you want to make sure that they're getting the help that they need. And that help is going to come from finding a relationship with a doctor who can help them. And they might have to try a few different doctors, but you are willing to go with them and have those conversations and try different things out. But that's important to you. So that's another way to broach the conversation. Again, a lot of times kids are going to have that pushback. It's going and persistently sending that message that we're going to keep working on this. We're going to be doing these things and let's work on it together, but we're not going to just avoid it or drop it. And you'll see over time that can help move the mark.
That's a great thought about, trying different therapists and, until you can find the right fit with someone that they can trust. What about you, Dr. Merkleys? What are your thoughts on this instance?
Yeah, I think that Dr. Glover hit on some really great points too, and that long game foresight as well, and looking at how can we make these small steps to build some of that trust, because that trust does take time. And also for you to have that self-care too, and making sure that you are getting that those times where you can kind of invest in how you're feeling with the situation too, because this does affect the whole relationship, so both you and your child, and so making sure that you're seeking out that self-care as well. It's important.
Thank you. That is really important to remember, because like Dr. Glover mentioned in the presentation, it's so easy to just want to like fix it as a parent. You just want to immediately rush and fix it. And then that it's can be a lot of a burden on like the, not burden, that's not the right word, but you know, it's difficult feelings for parents to deal with when you maybe can't fix it. So what about you, Dr. Hempel? What are your thoughts on this scenario?
I feel like they touched on all of it. Yeah, definitely making sure that you, you know, take care of yourself as well. And that's amazing that your kid is talking that much to you. Some of the easiest depression encounters that I've had are ones that the kid has already divulged a lot to the parent over a long period of time. And so the jump from there to getting them in with an actual therapist is actually much easier. So keep that conversation going. I would say that's very encouraging.
Yeah, for sure.
One other thing I wanted to add, sorry, I guess when I have time to think and hear the other doctors talk, I'm like, oh, here's another idea. One other thing to think about is utilizing the mental health resources through the school. So I don't know if your child has an IEP or not. And if they have, you know, depression, there's aspects to get some services through the school if it's impacting their education. But sometimes having that relationship with a school psychologist or a school counselor can also be helpful. Because that's a relationship that can establish over time. So my wife is a school psychologist, and she works with many kids who don't want to talk to her and hate her, and they come in for several months and don't do anything with her other than play some games and establish a relationship. And with many of them, by the end of the year or when they're into their next school year, they have a positive relationship and a different level of work is able to be done. So again, part of it is it's an establishment of relationships and thinking where you can plug those relationships in over time with people who can consistently show up for your kid in a calm and helpful way.
That's great. I think that's a great segue into another question that we actually had. Are there resources offered by the schools that I can ask about? And you mentioned that your wife is a school counselor. Can you elaborate upon that a little bit? Like what resources are available through the schools?
Yeah, so there are a variety of resources available through the school. So there are school counselors, and school counselors are for students in general education. They're there to provide kind of like limited supports, also help with, you know, picking classes, career development, kind of those general things. And then there are school psychologists, and school psychologists offer a range of mental health services that are focused on helping improve your kids' mental health as it relates to academics. So sometimes you can get connected to a school psychologist if your child is in special education, so they have an individualized education plan, and you can get mental health services that way. Sometimes you can get connected if your kid is not in special ed. You can contact the school psychologist and see if they can work with your child, even if they're in general education. Some districts allow for that, some don't. Part of it depends on the funding, but I would start with the school counselor or school psychologist and see what services are available. Finally, there are several school districts that actually partner with outside mental health agencies to provide therapy services. So for example, if you had a child that was in Aurora Public Schools, the school counselor or school psychologist or personnel could put in a referral for them to get services through a variety of different like therapy places in the community, and they actually come into the school and do therapy with your kid in school. So I think just be curious, ask questions, try to talk to the school counselor, school psychologist, or school nurse as a starting point of what mental health services are available for my kid in the school setting, and just ask a lot of questions and be persistent. But those are some of the avenues that you can ask about as a starting point.
I just wanted to I was curious, how has it been different with school, with the different help that schools are providing during COVID? I don't know.
I'd say most of them are still being able to see them virtually, and or if they're doing hybrid, they're still being able to see them in person.
Yeah, is that what they're doing? So they're just doing in person whenever they're in person school and they're doing virtual. Okay, that's good to know. Okay.
And if your kid does have an IEP or a 504 plan, the school is still required to deliver those same services despite the pandemic or despite being virtual or hybrid.
Okay, that's good to know. Let's see, another question. This came in. Can you talk a little bit about antidepressants and like I know parents may be concerned that maybe they're not safe for kids. Can you talk a little bit about the safety of antidepressants for children? How about Dr. Hampo? Would you like to start?
I will apologize. My 2-year-old is currently sitting on my lap, so if you hear any random squeals, that is why. So the safety of antidepressants has been pretty proven in teenagers, particularly the two that we most commonly use, both Zoloft and Prozac. There are some newer ones that have been used by psychiatrists that I've worked with. And at least at Advanced Pediatrics, we do have the ability of consulting psychiatrists over the phone, so they can help us with med management. You don't necessarily have to go see them. But the safety of the newer antidepressants are really good. Some of the older ones did cause some cardiac ones, but those are the ones we usually avoid in kids. So yeah, I would say parents should feel pretty safe about if that is the route that we choose to go, that it's going to be good for their kid.
Okay, and Dr. Merkleys, you have anything to add to the antidepressants?
Yeah, just if that is the decision made by the parents and the child and the team, the medical team, that we do a pretty quick follow-up for until we get to a good level for the child. And so there's a lot of touch points where if there are any concerns that we can talk about them, we can kind of reevaluate the plan. And I think that medication can be a really useful tool. It's part of the whole package. And so if we're noticing that we're kind of plateauing it with certain things that we've already started or already been using, then medication definitely can be a helpful tool for that process.
And what are your thoughts on that, Dr. Glover?
So one of the good news for parents is depression in children, both therapies and medication are one of the best researched of all the mental health disorders. So that's a really good thing. So we have a lot of information regarding what we're doing and what's effective. Sometimes medication is not needed, sometimes it is, and sometimes therapy will not work without it. So this is why it's so important to consult with your physician about what are the steps that make the most sense. Is it therapy without medication? Is it medication starting with other adjuncts? Is it both of those things? Because depending on your kid's unique profile and how severe the depression is, getting that combination right is going to speed along treatment and really help things. So I think being very open to hearing those recommendations and knowing that we have so much research on this that there can be, I think, more peace of mind than maybe people feel like they were expecting.
Perfect. I know one of the therapies you mentioned, Dr. Glover, during the presentation. Which one was that? Was it?
I talked about cognitive behavioral therapy and dialectic behavior therapy.
Can you elaborate a little bit on that? And then I'd like to hear the other doctors, like what are their thoughts on other therapies that are effective?
So cognitive behavioral therapy is kind of the gold standard treatment for depression. That triangle I showed you of the symptoms, cognitive behavioral therapy basically targets and usually starts with either your behaviors or your thoughts. If we can change your thoughts, usually that shifts part of your feelings or behaviors, or if we can change your behaviors. So we teach parents and kids how to identify faulty thinking, what are helpful behaviors to engage in that can help change that brain chemistry. So most of those last anywhere from 6 to 12 weeks for effectiveness. Usually after 6 to 8 weeks, you start to see significant improvement in symptoms. So we have protocols that we go specifically through that have been shown to be effective for young kids, for older kids, and for adolescents. So that's the first therapy. The second therapy is dialectic behavior therapy. Uses a lot of the same principles, except it adds a few things to it they're acceptance-based therapies. So the first therapy is all about changing your thoughts. Some people can't change their thoughts. And when you can't change your thoughts, you have to learn new techniques about how you distance yourself and see your thoughts, accept your thoughts, and use techniques when I can't change my symptoms. How can I still act in a way that's consistent with my values, where I don't harm myself, where I don't make things worse? So dialectic behavior therapy was developed for people who were in crisis, who were suicidal, but it's been tremendously helpful for adolescents who have relationship problems, self-harm, and impulsivity. That's kind of the treatment you want to go with if those are the features that you are seeing with your kid's depression. If those things aren't there, CBT is perfect. It works really, really well. So either of those are good treatments.
Right. And Dr. Merkleys, do you have any thoughts on the different therapies that are out there and available?
Yeah, well, I wanted to add just a couple things that can really augment those therapies and some of those just routine healthy habits for our daily lives. So making sure that we are providing that space for sleep, healthy sleep. So getting into those good sleep hygiene. So turning off our screens before bedtime, doing something that's really calming before bed, because that sleep is only going to help with that treatment process. And then making sure that we're getting in some movement throughout that day, and that can be so healing as we can put together all that we are learning and just have some of that freedom for that activity. Also to try to see for your youth what they enjoy, allowing some of that free space to just kind of release a little bit. And there's a lot of heaviness going on, and so when they're doing that hard work through therapy, it's really important to have some of that free space too.
Dr. Hempel, thoughts?
Yeah, again, just adding on augmented therapies. So meditation and mindfulness can be incredibly helpful, particularly for kids who are anxious and depressed. It can also help with the healthy habits such as sleep. So there are a few apps that are out there that like Calm and Headspace. Headspace even has its own Netflix special, which is actually just several short guided meditations. So if you guys are a little bit skeptical, not sure you want to really like delve into it, you can try one of those. I've actually listened to a few of them, and Headspace is my go-to when I can't sleep. I turn on one of their things, and just the calming, soothing voice in the rainforest sounds usually. It's very helpful, and there's actually some science behind lowering stress levels, lowering blood pressure in terms of using mindfulness and meditation. And then they've found that exercise is not only good for, like Meredith was saying, is good for our overall physical health, but mental health too. And then making sure, even though it's tough in a pandemic, we have some sort of social connections. So either making their video games more social, kind of making it so that they can play with their friends, or FaceTiming or any of that, and using like direct contact stuff. So I know they all love Snapchat and TikTok and all of those things, but I would try to encourage them to not use the social media interface and rather actually FaceTime their friend, or stand on their doorway 6 feet away and wave to them and talk to them as much as they possibly can.
Yeah, those are also good things for parents to remember. All those things: exercise, eating well, sleeping, meditating, mindfulness. Since we were talking about Calm and Headspace, do you guys have like your go-to resources and like apps that you recommend, books that you recommend for children and parents who think that they may be dealing with some depression? I think Dr. Hempel, do you have anything other than the Headspace? And you've already kind of weighed in on that one. Any books?
Yeah. No books per se. There's usually like YouTube, you can kind of find some of the mindfulness, some of the mindfulness meditations as well. I'm big on mindfulness and meditation, if you can't tell.
What about you, Dr. Merkleys, what do you think about? What are some of the apps that you go to or books that you've recommended?
Yeah, the one that or resource that I recommend very often is the AAP's Healthy Children website, because it does have just a searchable or a search bar that you can look through a lot of different questions on, and they have some great resources on their website regarding some helpful books, some helpful just articles. And so I do recommend that. That's just healthychildrens.org. I really enjoy the app Mindshift. Just one word. It does have something that you can actually send to people, so you can track how you've been feeling throughout the week, and you can designate people to send that to, so like accountability for that, and that's just a nice check-in. It also has just various activities to do, either breathing exercises or kind of distracting exercises as well. So that's a really great one. A very interesting book is called The Whole Brain Child, or The Whole Brain Child, and that's just, I think we talked about that at the last webinar as well, but that's a really very interesting book that goes through a lot of the science and the background for how our brains develop, and so that's a really neat book.
Dr. Glover?
The person who wrote The Whole Brain Child also wrote, it's called Brainstorm. It's all about the teenage brain and how that operates. It's Dan Siegel, so that's also a really excellent book too, if you're like, have a teenager and you're like, what the heck is going on? I agree, Calm is my favorite app. I use it every single day. There also is an app called Breathe Kids. So if you have kids who are like 10 and younger and you want to practice this with them, that's a great app for that. And then there is an app that I like, it's called CBT Companion. So it helps teach some of these basic, these are the thinking traps we get into. How do we change our thoughts? And it's for kids who are 12 and older, but that's a really great thing to have to be able to practice some of this stuff.
That's great. I've been writing them down. The ones that I don't know about. So I think that we are coming up on, we're about 2 minutes before the hour. So I'm going to go ahead and wrap things up, but I did want to go ahead and thank you again, Dr. Glover and Children's Hospital, for partnering with us on this really important topic. I'd also like to thank Dr. Hemphill and Dr. Mcclay for coming on and talking with our families today about this topic, this very important topic. So just in closing, just make sure that you watch for future Advanced Pediatrics webinars. And please remember that if you're ever in need of talking about any healthcare concerns that you have for your children, we're always here for you at Advanced Pediatrics. And Children's Hospital, Dr. Glover mentioned the resources there as well. And with that, we'll just sign off for the night. And thank you very much, everyone, for attending. All right, good night.